but I firmly believe with my whole core that if you set your morning right, it's going to structure the rest of your day.
Hey, ambitious dentist, welcome to Start Your Dental Practice, the show for existing and aspiring dentists to take your dental practice to the highest possible level. I'm your host, Jonathan Van Horn, CPA and ABV, founder of dentistmetrics.com. In every episode, we aim to demystify the how to start a dental practice problem by bringing on world-class dentists, influencers, and consultants in the dental industry to pick their brain about how to get past the barriers involved from going from no practice to being a practice owner to owning your own successful dental practice. So whether you've been running a practice for many years or you're just getting started, chances are that at some point you considered hiring a dental consultant. Unfortunately, hiring a consultant can often be a really big hit or a big miss. It's hard to tell. And while I've certainly heard my share of experiences, I've also heard my share of nightmares as well. So, while there's never a sure thing in business or life, consultants should be helping your practice grow and not holding you back. Which is why I'm very excited to introduce today's guest, Kiera Dent, who has extensive experience in both hiring the right team and consulting dentists all across the country. Here is some of what you'll learn in today's interview. What Kiera learned from working at Midwestern University and how it helped jumpstart her dental career. How working in the front and back office of multiple practices helped her deliver exceptional value to patients and clients. Why Kiera is hyper-focused in consulting offerings and how it helps her stand out, as well as the many lessons that Kiera has learned from working with the Dental Success Institute and the legendary Dr. Mark Costas, as well as much more. And if you've ever experienced hiring consultants or weren't happy with your previous experience, this episode is for you. But before I forget, there's only a few more weeks to enter the 4 books every dentist should read contest. At the end of the episode, I'll share how you can enter. So now, here's my interview with Kiera Dent. Hey guys, sorry for the interruption. Really quick announcement for you. And if you're going to be a dental practice owner, you know you're at some point going to have to get a dental practice loan, whether it's going to be to acquire a dental practice or it's going to be to start a startup dental practice. You're going to have to get a loan. And I'm really proud to say that a company that I've worked with personally dozens of times over the past few years is our first sponsor after 80 episodes of Start Your Dental Practice. And our first sponsor is Bank of America Practice Solutions. So whenever you're going to be getting a new loan, whenever you're going to get a loan for starting your dental practice or acquiring a dental practice, you really want to make sure that you have 3 things when it comes to that loan. Number 1, you want a really great interest rate. Number 2, you want to make sure that the company that you're speaking with has a lot of experience and can guide you through the best path to be able to become a practice owner through the loan process. And number 3, you want to make sure that the terms associated with that loan are the most advantageous for you. And I'm really happy to say that all 3 of these things, Bank of America just knocks it out of the park for you. It's really no brainer. If you're going to have to get a loan, which you are going to have to do 100%, you may as well go with a company that has great interest rates, has great experience with the industry, and has the best terms out there in the market today. So if you're currently in the process of shopping loans, 100% give Bank of America Practice Solutions a try. And if you would mention that you came through the SYDP community, it would help out the podcast a lot and also allow us to give back to our very gracious sponsors. Again, this is an advertisement, a paid advertisement. If you go to them, I will, have more advertising revenue come to me. So if you enjoy the podcast, I would appreciate you helping out our sponsors. And if you are interested in that loan process, just text the word bank loan, one word, BANKLOAN, to 33444. Again, that's bank loan to 33444, and we will reach out to you. Thanks, guys. Hello, ambitious dentist. It is not often that you can find a dental consultant that has experience with both startups as well as acquisitions, consulting, placement, pretty much all of the above. And today I'm really excited to have with you
Kiera Dent, who is, and that is her actual name. Her last name is Dent, with KieraDentalConsulting.com. She is a dental consultant, as well as she has a placement company that is called Dental Placement Pros that helps people find back office, front office, associates, pretty much everyone involved with staffing your dental practice. She has a wealth of information. She also works at Midwestern, so she knows a ton of the issues that the dental students as well as the new dental grads are going through. And so, Kiera, thank you so much for coming on today. I'm really excited.
Absolutely. Thanks for having me. I'm a huge fan of your podcast, so it's a really great pleasure and opportunity to be on this podcast today. So thank you.
Awesome. So, you've got a really large wealth of information or experience inside of the dental world. Where did you get all of that?
It's funny. I'm such a ridiculous person. And in high school, I had an opportunity to take a dental assisting course. And I didn't know if I really wanted to do it or not, but I got to wear scrubs if I did it. So I definitely went into dental assisting just solely to wear scrubs. That was my MO. It's kind of like in high school, I also wanted to make varsity tennis team so I could wear the cute outfit, and I did it. So clearly attire is my motivation in life, I think. But I really just got into it for the sole fact of scrubs, but then I fell in love with it, and I absolutely loved being a dental assistant, and then kind of my journey just went from there. So that's the truth of how I got into it, solely scrubs.
Very cool. And so that's how you got started in it. How did you make the jump from, being an assistant to becoming a consultant?
So it was kind of a fun journey. I was a dental assistant, really, really, really loved what I did. I then went into front office, typical of a lot of assistants, how you make that transition. Went to college, thought I would be a marriage and family therapist. That's what I was doing my undergrad in. And I met my husband during that time and realized I just loved dentistry. So when he went to pharmacy school at Midwestern University in Arizona, I did a little research on pharmacy schools, like where he had been accepted, and found out that if I worked at Midwestern, we could actually get a discount on his tuition. So I begged and applied, and literally a miracle, was able to get a job at Midwestern. And I remember Dr. Smith, who's the dean of Midwestern, he and I joke, he's like, you took a $12 an hour job and look where you are now. And truthfully, it was a scary thing to take a pay cut. I felt like my skills were going away, but Midwestern was, I feel, a huge springboard for me. I ran the simulation clinic, and I helped teach radiology, and I learned a lot about dental school and what students went through. And then upon graduation, my husband, he graduated, and one of the students from Midwestern, her and I decided to partner together. So we went and we opened some practices together. Straight out of school, we opened our first practice. I did a bunch of things. We moved locations. It was a whirlwind. And 9 months later, we opened our second practice. So we took our first one from about $500,000 to $2.4 million in 9 months. Bought our next practice, and since that time, we're just barely at the 2-year mark. There have been 5 practices acquired. So I worked with her for about a year as a business partner, regional, multiple locations. Learned a ton. We felt like 2 kids playing house some days. I didn't know what we were doing, but it was a lot of fun, and I learned a ton. And then my husband got done with residency, and I decided I should probably live with him again instead of traveling all the time. And in that moment, I went back and met with Dr. Smith again, and I said, Dr. Smith, there are so many students graduating that I would like to help out. That was why I started working at Midwestern, is because I felt like working in a private practice, I could only impact one office. And yeah, if I worked for the school, we could impact the world of dentistry in such a stronger way. So that's when I decided to start my own consulting company, and to help other people either buy a practice or increase their revenue. I mean, I learned so much. I had very successful practices, and also my experience as front and back office really helped me have more of a personal touch. So I decided to see if it was a stroke of luck with my friend or if I really had something going on. And I went to Oregon and helped one of my good dentist friends up there. And the first month I was in his office, we went from about 70,000 to 130,000 just in 1 month with some very small changes. And I was like, okay, I might be onto something. So that was and then he was really, really nice and asked me if I wanted to go to one of Mark Costas's conferences, but we got nervous because it would be another consultant with Mark Costas, and how do you not step on consulting toes? So it's kind of that weird, like, 2 dates to the prom, but Mark was super, super nice. And actually, when Mark and I met, it was kind of that, like, oh my gosh, we make a perfect match. So Mark and I joined forces together, and now I do all of his in-office consulting for his Dental Success Institute. Plus, I wanted to learn more from Mark and keep growing as a consultant. So I actually am his regional manager for 6 of his 10 practices. So then Dental Placement Pros popped up because Dr. Smith called me and said, Kiera, there's nowhere for dentists graduating from school to find private practice jobs. Like, would you consider doing a recruiting survey? And so all of these kind of came at one time, and I've had some growing pains for sure. But what I love is that I've been able to take my experiences, the things I've learned, and be able to, once again, like I said, impact the world of dentistry, but not just in one office. Be able to actually make a huge impact nationwide, even globally. We've got clients in New Zealand and Australia and Jamaica as well, and really be able to shape and form dentistry into that individualized customer experience, plus helping dentists grow and become much more profitable. So it's super fun. I love it. I get jazzed every time I go into an office. It's like an adrenaline rush. I should have been a dentist, but I just love riding on the coattails of dentists and making a difference in the world of dentistry.
It's amazing. You know, you've got multiple practice ownership experience. You've got ground up and acquisition experience. You help out tons of different dental practices. And so I'm really excited about this episode. So tell me from your experience, you know, when we talked about this conversation, we said, what's a good way for us to be able to give to the people that are listening right now? And one of the things we came up with was to talk a little bit about how to find the right consultant for your dental practice, and what to look for. Because, you know, personally, you know, I deal with a lot of people that have complained about consultants in the past, that feel like that there's something not working, or that they come in and, you know, they tell me to do all these different things that, you know, they may or may not do, and then they're gone, and you never hear from them again, and nothing ever seems to work. So tell me what it is that you've noticed that makes things change, like the change from the $70,000 a month to the $100,000 a month, you know, what sounds like almost overnight. What type of changes are there that have happened in those types of practices? What is it that is that missing piece to be able to find the right consultant for your practice?
Absolutely. Great question, because it is hard. It's kind of like dating, and like, who do you pick? Like, what do you pick on? Do you do it based on looks? Do you do it based on personality? Like,
well, I didn't have a whole lot of choices personally, so it was easy for me.
Exactly. Well, it's okay. All of us have our whatever. Yeah. Sometimes too many choices is not a good thing either, right? So, I'm sure that's not true for you, but
my wife does not listen to the podcast, so I'm it's easy for me to be able to get away with that joke. So
no, I think that really I feel like it's hard because consultants are usually a lot of money. And I know that. I also know what it feels like to be in debt because my husband's a pharmacist. So I feel like the difference between me and a lot of other consultants, because consultants are great and they all come in with different skill sets, right? I love, not that I'm boastful of who I am, but I really like that I've got back office. I was a dental assistant for years. Then I became a front office. I did all the treatment coordinating. Then I became an office manager. I became a regional. Plus, I own my own practices, and I bought a bunch. And then I also taught at a school. But yet there's a lot of people just like Kiera Dent out there that have a pretty similar resume to me. And so it's like, oh, well, they're all, you know, it's kind of like, how do you choose a dental office? What do? You look at reviews, you look and see if your insurance is covered. But to me, I feel like it's one step further. And what I like about what I do is that I don't profess to know everything. A lot of consultants come in and not that they profess to know everything, but they're kind of like an expert in all fields. And one thing I love about what I've done partnering with Mark is that we have 4 experts on our team. I feel like I'm the expert of practice management. I can go in, I'm boots on the ground. I know what's going on in that practice and I can change it. Like, I have my eyes dialed in to be able to see those things. And then Mark is clinical. So we've got a dentist on our team that then can help the dentist with the things that I feel like I know the dentist world really well, but I've never been a dentist. So to have Mark as a good springboard plus all the other dentists. We also have Jake, who does all of our numbers. I am not going to lie to you. I hate watching the numbers. Like, I watch them to see, but Jake is so much better at numbers than I am. He's so much better at seeing overhead, and he'll come to me and tell me, hey, Kiera, this office needs help in supplies. Well, cool. When I'm in there, now I have a filter of what I'm looking for. And then we have Ashley, who's all about business. That girl knows how to credential. She knows how to get business licenses set up. She knows all the back end and how to do it in a really effective and efficient manner. So that's one reason I like working with Dental Success Institute, because I feel like we are all experts in our own field and we make a much stronger team than just me, myself, going out and trying to do all those different things. And then really, I think it comes down to if you like them. But my offices, probably because I did my own practices and I had to work really hard. I know how hard it is to implement those changes. I know how hard it is to put systems in place in multiple locations. And so I refuse to let my offices fail. Now, once again, a lot of other consultants could say this, but like you were saying, they come in, they give you their stuff, and they leave, and you never hear from them again. Mm-hmm. No way, not on my watch will that happen with any of my offices, because I firmly believe that one of the reasons people don't implement is there's no accountability. Like, it's just like I love to run marathons in theory, just to say I did a marathon, but I hate training. And if I don't have somebody checking in with me regularly, I don't do my trainings. And I think it's the same thing with dental offices. We can go in and get all jazzed about all these different things. You know, you go to a CE and you get super jazzed about all the stuff you want to implement, but then you get home and you're like, well, where do I even start? So then you don't end up doing anything. So when I go in, and what I would recommend for anyone listening, when you're looking for a consultant, kind of get their viewpoint and philosophy of how they do it. I literally will go into an office and I get the doctor's opinions of what they're looking for before I get into the office. And so I kind of have the doctor's filter through my eyes, but then I look at the practice as a whole. And when I leave there, I have at no more than three action items, and then I have a perfect follow-up with them. And I do not let them slip through the cracks, period, because otherwise it wasn't a benefit of your time or my time to be in that office, and I want them to succeed. And then I use the rest of my team to help make sure that all my practices are succeeding. So like that office I talked about in Oregon, yes, he was a quote-unquote over 1 month success, and it was amazing. But why? He hated morning huddles, hated them. And I'm not kidding you. Every single day I texted him for a solid 2 weeks. He got a text from me every morning that said, hey, Justin, make sure you're on time for your morning huddle and let me know how it goes. He hated going, but I told him and he committed to it. And so it was me helping hold him accountable. And I really think that that is one of the best things a consultant do. One of my other friends who's a consultant told me that the two things a consultant has to have is perfect follow-up and perfect accountability checks. And I believe that. I think without those consultants, we really come into our thing and then we leave. And if those two things aren't in place, it's very hard for a practice to move forward.
Absolutely. So whenever someone is in the market for a consultant, what are the types of questions that need to be asked that can help someone figure out if the person they're speaking with is a good match for them?
It's a great question. I think it comes down to dialing in the dentist's goals. The dentist is sitting in the whirlwind. They can see the immediate fires right away. Mm-hmm. And I would ask from that from that point of view, if that consultant has that skill set. And it's just like when you interview anyone for a job, right? You're saying like, hey, dental assistant, do you know how to do implants, crowns, fillings, whatever? But then you want to go one step forward, because usually people will say yes, but how good are they at actually doing the things you want them to do? I would reference check. I have people reference check on me all the time to make sure that the things I'm promoting and saying that I actually can do, I have visible proof that I've done it and I know how to do it and I will do it. So I think a lot of it comes to going to them just like you would interview anyone else for any position, and then checking the references on them. Like that's what we do at Dental Placement Pros, because I want to make sure that who I'm bringing in actually is going to achieve the things that I'm wanting. So if you're really looking for, you don't want someone who's in office, you're looking more for an online, you just need somebody to help you pick up a few things here and there. Like I had one office in Texas. They didn't need somebody in the office. They're doing so well with their system. All they needed was for somebody to analyze their numbers and to find their low-hanging fruit so they could become a more effective office. that's a totally different type of consulting than like, you know, I've got a practice in California that I went into, and her whole team, you know, was not doing what they should have been, and they ended up quitting when I went into the office because it was such a broken practice.
Sure.
And so I really think you have to identify as a dentist what you need help with, and maybe you don't know, and that's okay because things will be revealed. But I promise every dentist knows like the top 3 things that are the biggest fires, and then find out if that consultant really can do those things and how they're going to do it. You know, some consultants come in with a packet of information that works for every office. I am anti that on 100 levels. Yes, that would make my life so easy to just go in with a packet of information, but I don't feel that actually makes, it's like not every patient gets the same treatment plan. I don't believe every office gets the same consulting either. So that's probably what I would recommend asking when you like interview your consulting agency. And then also, a lot of people, they like my style and Mark's style because we're personable. We don't act like we know everything because we don't. We're not promising. I have some consultants that promise that they'll hit certain numbers. Yeah, I'm pretty confident in myself that I'll grow your practice. But the fact of setting us up for certain numbers and certain expectations, there could be a lot of things that are broken below those numbers that we need to fix to get you to those numbers. So I'm all about giving very clear expectations that we can actually hit and achieve in a manner that you agree with. I mean, and that's how I do it. And then if you don't like me, that's totally fine. If you love me, great, let's keep working on the relationship together. But I feel like, and then another thing, sorry to be a little scattered with you, but is personality. Like, do you get along with that person? Do you like them? Because if you don't like them, you're not going to want to do your follow-up calls. You're not going to want to implement what they're doing. And then just make sure that the results you want to see, you're tracking them too. Because sometimes we can get stuck in things like, oh, this consultant's doing great work. But then you look at your bank account and you're like, what the heck are they doing? And then you have to assess, okay, well, maybe we're fixing our broken culture, or maybe we're fixing these other things that aren't reflecting to my bank account. But just making sure you as a dentist also have checkpoints of what you want to see happening to ensure that consultant is actually growing your practice and moving it in the direction that you want for your practice.
A lot of golden advice in there, especially the piece about, you know, there's some consultants that will guarantee some specific amount of increase or whatever it is. And then they come in and they literally give you a notebook of everything you have to do in order for that guarantee to be achieved. And it's
exactly.
It doesn't matter what you want to do as a business owner. It just matters what they've seen work in one practice or another. And, you know, the more and more you get into this industry, the more and more you realize that, you know, every practice is different. Every dentist owner is different. Every team is different. Every patient is different. Every, you know, demographic, every area of the country, you know, the list just goes on and on and on. So to think that there is some type of, you know, we do A, B, C, D, E, F, G, and specifically this one way, and then all of a sudden your numbers are going to go up. It's just, to me, it's just dumbfounding that can be a mentality for some consulting companies. So I really like your approach. I really like that you acknowledge that it's different. Okay, so as far as other, you know, things that can go on, you know, you talked about, you know, having that accountability, having your head, some of the major areas in your practice that you need to work on. I would also maybe add on to that to also be willing to say, to realize that the things that you think are issues may not be the real issues. Like you said, there's underlying issues sometimes that the dentist isn't aware of. Like maybe they aren't, you know, doing team meetings, and that's the reason their team doesn't work together well, or something like that, right?
Exactly.
Yeah.
Right.
So, okay. So that's really good advice. But go ahead.
Sorry to interrupt you right there. I think it's a really good time right now to tie it into a dentist's world. And like you just mentioned with that, think about a patient. And as a consultant, what I do, just like a dentist will do, a patient comes in and they have, you know, like, oh, this tooth right over here that has a teeny tiny cavity is what they're coming in for.
Mm-hmm.
But yet they have perio and they need to have a huge extraction on the other side. So as a dentist, you see the bigger picture, right? You can see that, okay, yes, you want this tiny filling fixed, but yet we've got like a massive explosion on the other side of your mouth that we should take care of. But that patient is not going to respond to you until you take care of that cavity and they feel heard by you. And I think it's the exact same way in consulting. I can walk into an office and I can see like, okay, I know you told me you want to increase your production, but yet you have like 100 other things that we should probably fix before we even talk about production.
Mm-hmm.
However, if I don't dial into something that dentist wants, they don't see that I actually heard and listened and internalized what they wanted. So I feel like it's very important. I work really hard to make sure I at least hit one, if not two, of the number one concerns, and hopefully all three of the number one concerns, while also showing them a few of the other things that we could work on as well. And I just wanted to paint that picture of how a doctor will prescribe it to a patient, just like I work with my dentist the same type of way. So tacking into one of those things that they know is a problem because that's all they can see, but then also letting them know some of those underlying issues that could help prevent those problems in the future.
So to move on from that, as far as whenever when a doctor is considering hiring a consultant, what type of time frame should they typically be looking at to commit to having a consultant help out a practice?
That is an open box of worms because it really depends. It depends on how your practice is. And like, I don't have a set, I work with every office for a month, or I come and follow up with you every 3 weeks, or, I think the traditional consulting mechanism is 1 year and we come in 4 times a year, every 3 months. Like, that's a very standard consulting model. And I'm going against the grid in that you might think I'm like a free-willed consultant, but realistically, I do agree you need to if you want them in your office, you need to at least commit to 6 months to see the results. Because just like anything, you start working out, you don't see your six-pack that day. You've got to give it a little time to be able to actually see the results of the hard work you're putting in. So I would say a minimum of 6 month commitment if you really need like some strong in-office changes. So like I talked about that other office that needed, just low-hanging fruit, they increased their production drastically just by picking up. But they are really, really, really good implementers. If you know you're not a good implementer, or anyone's told you you're not a good implementer, you might want to commit to that 6 months to a year. I'm not a fan of consultants, and this isn't bashing any consultants out there whatsoever, because I think all methods work. So I hope nobody takes it that way. But for me and my methods, I don't like setting you up for 3 month check-ins. I don't think it works. Just like, with a patient, I'll tie it right back to their world. Patients don't need to come in, every patient doesn't come in at the exact same time. Every patient's different, and that's how I treat all of my clients. Some clients, I need to go back in 6 weeks because they're really struggling with implementation, so I'm going back in 6 weeks. Other offices are amazing, and I just need to check in with them once every 6 months and make sure they're doing okay. But I consult that with each office and let them know kind of my game plan and make sure it aligns with them. And so, but to give a very simple answer to all those listening, I would say if you're serious about in-office consulting, I would recommend a minimum of 6 months, but probably plan a year to see the results you're looking for. So
as far as the consulting process, someone decides, hey, I think I could be doing better. I've done everything I can personally to make this team as strong as possible. So I'm now going to search for external help. They contact hopefully a few different consultants to get different, proposals and see which companies they jive with the best, as well as to get the action plans to see what makes the most sense for them personally. They can make the commitment 6 months to 12 months, whatever it may be. What should that dentist then be? The answer probably is going to be, it depends on the consultant, but what should the dentist then be considering? What should they then be expecting once that proposal has been signed?
For me, I try to get in there as soon as possible. So I don't like to wait, because usually by the time they call a consultant, we've got fires brewing. And so it's important to get in there and start to stabilize the situation and help with the growth. But also one thing I want to tap into that you mentioned, I don't think that all dentists need to wait until there are the fires brewing. Sometimes having a consultant before you have all those big fires, or you think, and even if you can't commit to 6 months or to a year, sometimes just calling and getting started actually can increase revenue for you before you feel like I've got all my ducks in a row and I'm ready for a consultant. So I would say, but as soon as you reach out to that consultant, I would expect them to get in there. Like we said, every consultant's different. But for me, I try to get in as soon as possible, or at least do some type of help. So even if I can't get in, I'm booked out for a while right now, and if I can't get into my offices, I will do phone calls with them and start to get their team leads on board and we start to set goals before I can be in the office with them. Just making sure that whatever that dentist is seeing is the huge fire hose, like we need to take care of this, we're actually starting to manage and make steps in the positive direction so they can have the results they're looking for.
Perfect. So I think we've done a really good job of outlining kind of the consultant time frame and what to look for, what questions to ask, and what you should just generally be expecting from that process for people. So tell me now, let's move on to your specific experience in this industry of what do you feel like is some of, you said like the top 3 fires that people typically need to be able to bring to you to be able to have you approach and see what issues you can help with. What to you is the biggest missing link in dental practices?
Biggest missing link I feel is accountability. And it's because dentists have so many plates that they're juggling. So whatever fire is in front of them is usually the most important, but then another fire comes to them. And so I did an example a while ago when I was speaking, and I had a bunch of pencils and I threw them up in the air and asked somebody to catch them with one hand. Well, clearly, you have 25 pencils thrown into the air trying to catch with one hand. You might get 3 to 5 in one spot. But then what I did is I took all 25 of those and wrapped them with a rubber band and threw them in the air and said, catch all these. Pretty much anyone can do that, right? Mm-hmm. And the idea behind that is if you have a coach or a consultant or someone helping you, you can manage so many more fires without it all being on your plate. Yes, ultimately the dentist still, no matter how great of a consultant they have, at the end of the day, the leadership is on their heads. They are the one leading the practice. They're the one that everybody turns to. They are the one who ultimately have to keep those fires at a minimum and keep all 25 of those plates spinning at the same time. But having a consultant or a coach, like you asked, what's the number one thing? Is really having somebody to help keep them accountable, to make sure things are moving forward, and to keep them focused. I think a lot of dentists are amazing at what they do, but they lose that focus. So, maybe the top 3 things, like they're so concerned about production. Well, to hit production, we need to get our route slips going. We need to make sure we're having our morning huddles, and we need to make sure that we're doing a reactivation campaign. All 3 of those things are going to help increase our production. We might not see the fruits of those labors this month. I always hope that in 1 month you see increase. But a lot of times dentists will say like, okay, Kiera, I'm committed to those 3 things. Well, then the next thing I know, they've implemented like 5 other things. And I'm all about the philosophy that if we focus on those 3 fires and we dial them in and we really, really, really own them and become proficient in them, we're able to move on to the next level and actually become so much better as opposed to adding in so many more things. So having somebody coach them, keep them accountable to just having like a clear, direct vision is how I feel like I see my practices grow. I mean, that practice in Oregon, let's tie back to him. We did 3 things, and I made sure he did those 3 things religiously for 6 weeks, and his production increased because he was focused on that. Whatever we focus on is what we achieve. So helping your team become accountable and also just focus on those small items, I think actually make bigger impacts than implementing, 25 things in a month, because that becomes very confusing for everybody. Nobody knows then what to focus on.
Absolutely. And just in general, the teaching of the importance of accountability in dental practices is also important for them as a leader to learn. I feel like that's also, just in general, the accountability factor is just missing so often in dental practices. We find so many docs get taken advantage of because they don't end up holding their service providers accountable, which is people like myself and people like you, Kiera, that, we're service providers. We try to help dental practices. I'm going to say that we're the good guys, that we're doing it regardless of that, but there's a lot of people out there that aren't being held accountable and they let everything slip and slide and go one way or the other. There was just the other day a marketing company that was getting bashed all over the dental forums because of the fact that this doctor had had just said that had said at the beginning of the relationship, I want you to give me these pieces of information so I can help hold you accountable. And this company said, sure, okay, we'll do that. 8 months in, the dentist says, hey, you haven't given me any of this stuff. Can I have it? And they say, well, we don't do that. And then all of a sudden he realizes that this company he's paid, $30,000-$40,000 and they haven't done anything. He hasn't seen any results from it. And so he decides to try and fire them. Oops, he's in a 12-month contract that he can't get out of now. And so the reason those types of companies exist is because there are so many people that don't hold them accountable. And so I believe you. High five, amen to that. The accountability is so missing in so many practices. So
it just ties back to what I said, those top two things of follow-up and accountability. That's how you know you have a good consultant, like making sure they follow through with what they say, making sure you keep those promises. Like you said, it's so easy to lose that. But if you have a consultant focused on those things that you know has great follow-up, good accountability, they're focused on your practice. They're not going to let those things slip through the cracks. Or at least I hope. Like, that's the hope, right?
Oh, yeah, absolutely. Absolutely. So, so accountability is one. Is there any other thing? Are there any other items that you can think of off the top of your head that are, big pieces that practice owners are missing that can make a big difference in their dental practices?
It's so broad, but
Sure.
Typically when I go into an office, things that I see, it's all those accountability checks. So like a morning huddle, we're checking in there. A route slip, we're checking in there. An end of day checklist, we're checking in there. I come from a family, there are 7 kids in my family, and I learned very quickly on in my life, hallelujah, my mom did not give me the task of having to clean up the dinner table by myself, because guess what? Like, that would have taken me all night long, every night to do it. But yet we divided the work amongst 7 kids, and we could have dinner cleaned up in 10 minutes. It was so fast. And so as a dentist, as a leader, a lot of times they feel that if they're not doing everything, the practice is falling apart. And to me, I'm like, no, build some systems in place so that way everything's getting done and you just have checkpoints to keep your team accountable. So I'm still tying into that accountability, because what I see, do your morning huddles, do your route slips, do your end of day checklist. You just divided the work amongst your whole team, which is so much easier than you checking all those points and have that information brought back to you. So it's more an accountability, but with a system in place. And so many offices, myself included, when I had my practices with my friend right out of school, I was awful. Like, I felt like I was running a circus some days, which is why I do what I do now, because I don't want people to feel that. So really getting those systems in place, and that's why I get calls all the time, Kiera, how do we implement those systems? And I think it's more picking one area, starting there and honing that in, and then adding to the next layer. So I know that was a kind of broad, not direct answer for you, but hopefully that clarified a little bit for our listeners and for you as well.
Absolutely. So one thing we also like to do on the podcast is, if we can leave, one specific, very specific thing, even if it's something that wouldn't apply to everyone, what is one specific thing that you like to implement inside of practice? Like you said, the routing slips and the holding everybody accountable. And if you want to be, hone in on like what should be on that routing slip, then that'd be fine. But what is one specific action that the owner docs that are out there currently can implement in their practices that will have a big effect on their practice?
People might hate me for this one, but I am a firm believer in morning huddles. And Mark Costas and I just had to talk about morning huddles. Yes, they have to be productive, otherwise it's a waste of time. But I firmly believe with my whole core that if you set your morning right, it's going to structure the rest of your day. So yes, there's so many ways, and I've got a lot of information on how to have an effective morning huddle for offices, but really getting your team accountable, having them bring that information to you for a morning huddle, so you as the doctor can kind of navigate throughout your day. We address problems at the beginning of our day that can make our day go so much smoother instead of dealing with them. I feel like a morning huddle allows each practice to be very proactive in their day instead of reactive. So you're getting actually the day that you want to have instead of the day that's tossed at you. And if I were to encourage all practices out there to do one thing, and maybe you're already doing it, so maybe you can up your ante. Like, we just changed our morning huddles and all of my practices to track more things. So there's always a way to improve our morning huddles, but have a morning huddle. Like how Elrod says, seize the morning, seize your day. Like, really, if you can do one thing to help your practice, it's those morning huddles.
Perfect. And so last piece, we've talked a lot about accountability, but we haven't really defined accountability for the listeners. So if someone out there is hearing the word accountability and they think that they know what that means, can you further, describe what accountability means to you?
Yeah, of course. Accountability to me means you are, kind of ties in with integrity, right? What you say you're going to do, you actually do it. And making sure that you have benchmarks in place to keep going with those goals that you're setting. So if you tell your team, we are going to have a morning huddle every morning. Well, then at 7:45 every morning, you're having a morning huddle and you are staying accountable and true to your word that you are doing that. Because when your team trusts you and they know that what you say is what's actually going to happen, you become such a stronger leader. So it's really owning what you say and following through with it. So another example would be you're being accountable to, and we are going to review our production and collection every single day. So that way we all know where we are and we're going to look for same-day opportunities. Well, you said that, so you are accountable by adding that to your morning huddle. And then every day you're watching those numbers so your team then knows you're staying accountable to it. If you say, we're going to be accountable to Kiera to make sure we do our route slips. You follow through and you have a system in place to where every night those route slips are checked. You confirm on your production reconciliation that we did everything that was said. And then you have a system in place to where your front desk checks all those route slips to make sure they're done. So it's just owning what you say, but then putting into place little checks to make sure they don't get forgotten. And that's, to me, what I feel is being accountable.
Love it. Love it. I tell everyone it's setting an expectation and then following through with it, and then making sure there's some. Perfect. If you don't do it, there's someone that's going to notice, and then like you said, with integrity, if you say you're going to do something and then you don't do it, then that's a mark on you. I mean you're going to look bad. Sometimes you have to hold yourself accountable, and that's the hardest most of the time. When it's just
always, right? Because we can lie to ourselves. We can lie to ourselves all day long, right? Like, of course I'm going to work out tomorrow, and the next day, and the next. Like, we can lie and justify to ourselves, and that's where, like you're saying, that I think is when you can. That's the definition I think of self-mastery, is when we can commit and keep our word to ourselves and to everyone else. I feel like that's a very well-mastered person.
Very cool. So. Last question I have for you today. Really appreciate your time. One thing we like to ask people that have been practice owners or have been through this process. So for all the people that out there who have not or who are not yet practice owners, well, I like to ask people on the podcast is, if you were to start today and you were going to go buy a practice or start a practice up, whichever one it is you're going to do, what would your strategy be in today's environment?
Oh, that's a good one, because I do this regularly. Mark Costas and I are always looking at practices. I look with students all the time. And I have a totally funky approach to it because, I don't know, I probably come from a different background than most people out there. But if I was doing it today, I think demographics play a huge part of it, but I also believe you can be successful in any market. So, but it's harder. So,
sure.
Kind of determine what you want to do. Like, I think when I talk to students and they're getting ready to buy a practice, I ask them a series of questions. Number one, what's more important to you? Do you want to make a lot of money, or are you more concerned about where you live, or do they go hand in hand? Because they can still go hand in hand, but I think that those two can definitely go against each other. So location, the amount of profitability you want. Are you looking for a startup, or do you want a practice acquisition? And then based on those 3-4 questions, that's going to kind of let us fine tune and narrow in. Then based on if it's a practice or a startup or it's an acquisition, from there, there's 2 different routes to go. So it kind of funnels down. If we're doing a startup, we're definitely wanting to play into demographics, and there are tons of resources out there. And then making sure we have a really good campaign once we get our demographics down, making sure we have a really strong new patient campaign so we have those patients, like have been mentioned by so many people, the 100 new patients your first day opening. So that strategy going that direction. Or if it's an acquisition, I run a bunch of reports on my practices to make sure, I'm looking for opportunities to grow the practice. And looking for opportunities to what's their marketing, really looking and diving into what that practice is currently doing and what value you can add to that practice. And don't lie to yourself on those. It's very easy. I think when you're looking to buy a practice, you emotionally get invested in it. And I say, no, look at it from a very, very, very strong standpoint of being analytical on it. Like, don't fall in love with it right off the bat. Make sure you've done all your research, because like my husband said, you can love the rich just as much as you can love the poor. And same thing with a practice. You can fall in love with a dinky little practice that produces tons and tons of money, or you can fall in love with one that's gorgeous on the outside but is broken and failing on the inside. So make sure you're really wise with what you are, and make sure it's very crystal clear. And then from there, after we've determined our location, And I tell students in school, like one of my biggest shout outs I'm going to give right now is become the most valuable resource you can be in school. You have this training, so become implant certified, become Invisalign certified, do the crazy hard surgeries in school with a leader watching you, because guess what? When you're out of school, that's all on you. And I just helped a student the other day. We were looking at a practice, and like 60% of the revenue was coming from gum grafting. He does not do gum grafting. So guess what? That practice is going, even though it's super great on numbers, he cannot do the procedure that's feeding the bulk of the patients to that practice. That would be a terrible investment for him unless we can find in a periodontist, but it adds a whole new level. So I tell students all the time, do as much as you possibly can. That's how our practices were so successful upon opening when I was with my friend from Midwestern, because we could do all those procedures in-house. So become your most valuable asset as a student right now. And that's also going to help as you're looking at those two different like routes of, startup or practice acquisition. And then call in your resources, reach out to people like myself, to other dentists that have done it in your field. Don't be afraid to ask for help and ask a ton of questions, because most of the information out there, people are willing to give you for free. And if you can rely on other people who have been there before, like you have two choices. You can make all the mistakes on your own. You're going to learn really well. Like I did. I learned a ton. Or you can ask veterans who have already been there, who have already made those mistakes, and who can guide you in a much easier route than you would do on your own.
Love it. Perfect advice. Great advice. So, Kiera, thanks so much for coming on today. If someone else is wanting to find out more about you, or to find out more about the your staffing company that you're starting up, actually I want to talk about that real quick, because I realize we didn't talk about it. Tell us about dental placement services, or tell us about what's going on with your company.
Of course. I hope people have made it this far in, because really this is like a gem that I have to throw in there. Hiring is hard. It is hard work. I had 32 employees, and I felt like a revolving door of hiring. I'd place an ad, I'd get like 12 resumes in, but by the time I got back to them, guess what? Like half of them already had jobs because I didn't catch them quick enough. And I realized that when I was working, that was my life day in and day out. And I'm like, I would seriously pay somebody to do this just to find me good quality work. And that's how Dental Placement Pros was started. And so what we do is we find those amazing candidates. Mark Costas has our commercial right now, looking for unicorns. And really, we work our tails off to find you the best of the best, because I want you to have them long term. So if you're wanting help with dental assistants, front office, back office, office managers, hygienists, even associates, because associates are way hard to find. I hired and interviewed, and I have hired my own associates, so I know how hard that is. We do it, and then I also offer a 2-month guarantee on every single hire. So there's really no risk, whether they terminate or you terminate, which I pray that doesn't happen. I hope I find good enough people, but that can happen. But we guarantee all of our work that we do. So we take out all the hard work. Literally, we do the screening, we do the reference checks. I have strong interviewing questions. We make sure that they're with an interview. We actually see them before we send them to your office to make sure that they're professional. And then we send them to you. And at that point, all you have to do, we send you an entire packet of information, reference checks, everything. And you literally call them up, interview them, have them come in, and you either hire them or you tell us how to refine our search for you. So my goal is to make hiring simple, effective, and perfect literally every single time you work with our company.
Love it. Yeah, the associate piece is so difficult to find good associates because of the age-old issue of most of the good associates go on to be practice owners.
Exactly.
There are definitely ones that are out there that are fantastic. But man, they're hard to find. So that's a great service you're offering.
And I'm just going to plug in here, any of those who are not in practices yet, who are still in school that are listening to this podcast, give us a call, because I only work with private practice or DSO models. So I'm not corporate. And I have offices nationwide looking for associates. And these are really, really, really good offers, because I know what the market is out there for associates. So then I am that mediator between the associate and the practice owner of how to get it. If you want partnerships, if you want just an associateship, you name it, we have them nationwide. So give us a call, even if you're thinking maybe in a year, because I already have people interviewing for next year when they graduate to hire them on. So it's never too early to call and reach out and get on the board so we can find a perfect match for students that are still in school.
Love it. Awesome. Well, thank you so much for your time today. We know that time is the one thing we can't replace in this world, so we really appreciate you giving us an hour of yours today. If anyone is interested in speaking with you more or reaching out and having any types of questions, what's a good way for them to be able to be in contact with you?
Absolutely. Thank you. It's kierasdentalconsulting.com. That's KIERAS, kierasdentalconsulting.com, or Dental Placement Pros with an SPROS.com. Or they can always reach me, text or email, 801-885-5351. So hopefully we can help out whoever we can in whatever ways. And thank you so much, Jonathan, for having me on the show. It was really, really good to talk with you today.
It's great getting connected with you too. I've heard a lot about you, and you're the real deal. So we appreciate you again. So everybody out there, thanks so much for your time, and we'll see you next time.
What's up, guys? Are you one of the many docs out there that know that there's just a ton of content and information out there that is designed to help you become a better business owner, but you don't know where to look or to spend your time, what to read, what to listen to, what to ingest, of what to be able to take in to educate yourselves to be a better business owner? You're not alone. I get this comment or this question almost every day from listeners of the podcast, as well as other dentists that I speak to every day. So what I've done to be able to combat that is I've gathered up my 4 most favorite books to give to you guys so that you can learn about business. Now, these are business books that are specifically designed to teach you about the different core concepts and skills you need to be a better business owner. And I'm actually going to be giving away a set of these 4 books every single month to Start Your Dental Practice podcast listeners. I'm really excited about it. So in order to find out what these 4 books are, as well as to enter yourself into the contest to receive a free copy of these books, all you got to do is text the word 4 books. That is FOURBOOKS. One word, no space, FOURBOOKS. And I will send you an email about what the 4 books are, my suggestions, why I think they're so great for you to be able to listen to, and you'll also be entered into the contest. And don't worry, if you already have the books, or if you already read them, then you'll still be entered into the contest, and you just let me know, and I'll just give you an Amazon gift card instead of sending you the books. So, guys, this is my way to thank you guys for being listeners of the podcast. I hope that you'll text the word 4 books, FOURBOOKS, to 33444. Again, that's 33444. And you'll be able to save a bunch of time on finding out what books you need to be reading. And so that's it for today, Ambitious Dentist. Again, I'm Jonathan Van Horn, CPA and ABV. I'll see you next week with another world-class practice owner or consultant that will help you start your very own dental practice.